Birth control, which one's right for you? Let's talk. Hey, I'm Dr. Durowade from Dardur Gynecology, here to make uncommon knowledge common. So there are a variety of birth control options on the market. So that can make it really hard to choose or know which one's right for you. I always tell my patients that it depends on what you want. Some people, they want convenience. Some people want something they can control. Some people want something that's easy. And so I start them with the different kinds. Let me tell you the options that are available on the market. There's the pill, there's the shot, there's the ring, there's the patch, there's the implant, the one that goes on the arm, and there's the IUD, the intrauterine device. So let's start with probably the most common form of birth control out there, which is the pill. It is a hormone pill. You have to take it at the same time every day. It comes in a pack, usually a pack of 4 or a pack of 3. You take the hormones for 3 weeks. The 4th week is hormone free. So even if there are tablets, there are no hormones in those tablets, and you're supposed to have your period that week. So some women who want control, a little bit of control over their periods, and when their period comes, the pill is a good option for them. Now, common side effects to the pill, breast tenderness, increased appetite, maybe a little bit of weight gain. So some women, because of these side effects, might not want to choose the pill. Let's talk about the second most common option, the shot. Everyone's heard of the depot shot. That's given every 3 months. So women who are looking for convenience can just go to their doctor and get an injection every 3 months. It's not my favorite because it causes weight gain. I've seen women gain about 50 pounds on the depot. Yes, it's possible. And I've seen women who don't get a pound. But the majority of women, weight gain is the reason they do not go for the depot shot. The way it works is that it increases your appetite. So you just eat more, and that's how the weight gain happens. Next, let's talk about the patch. I like the patch because it's not as strict. You can find any discrete place to place it on your body. It's once a week. And then you place one every week, and then the 4th week, you don't put a patch on. That's the week you have your period. Common side effects with that, nausea, moodiness. Some people even have increased spotting. When they're not expecting their period, they might have increased spotting. For some women, it works great. Some women, it balances them out. They feel great on it. So it kind of depends on your body's composition. But if you're looking for convenience, the patch is a good option. The next option is the ring, the vaginal ring. Now remember, the pill is every day, the patch is every week, the ring is every month. So you insert the ring. It's a flexible round ring. You can squeeze it together. You insert it into the vagina like you would a tampon. It stays there for 3 weeks. And then the 4th week, you take it out to have a period. So if you're looking for convenience, if you're comfortable putting tampons in, the ring is a good option for you as well. Less side effects with the ring than with the patch and the pill. A lot of women tolerate the ring very well. The limiting factor is being able to place it properly inside the vagina. Now, the implant, the one that goes in the arm. It looks like a little thin rod. You do have to have an incision. So they'll make an incision in your arm, put the rod in. Very tiny incision, it doesn't hurt that much. It's not also my favorite is because it can act like the shot. It's progesterone only, breast tenderness, nausea, moodiness, weight gain. People complain about those things with the implant. However, I have patients who absolutely love it. So again, it all depends on your body composition. It lasts 3 years, so it's not something that you have to be going to the doctor every month or take every day. Convenience, it lasts 3 years. And if you tolerate it well, it's a great option. For women who don't want periods at all, they love the Nexplanon or the implant because it can take away your periods entirely. The shot can also take away your periods entirely. For women who are looking specifically for no periods, convenience, last 3 years, the implant is a good option. The next one is my very favorite, the IUD. It gets a bad rep, but I really love it. It lasts 5 to 8 years. It's the best for teenagers because it's hard for teenagers to remember to take a pill every day. Hard for busy women to do that too. So if you're looking for something convenient and you're not planning, to have kids in the next 5 years, great option. The limiting factor for this is proper placement. If it's placed properly, it's not gonna move. It's not gonna get stuck. It's not gonna fall out. It's not going to get out into the rest of your body. There's lots of stuff online about how bad the IUD is. But if it's placed properly, it's gonna work well. I like it because it just works inside the uterus. The local effect of the progesterone is mostly active within the uterus. So all the side effects that you see with the other ones, the pills, the patch, the rings, are not very evident with the IUD. It makes your periods lighter. It makes your periods less painful. You know, for people who have unexplained painful periods, the IUD is the best choice. I really like it. It's easy to place. We have many medicines to keep you comfortable while we're placing it. So most women don't even know I'm done. They're just like, oh, that's it? So choosing a birth control, you know, we have to look at your whole history. Do you have high blood pressure? You know, is it not well controlled? Then the pills, the patch, the ring are not good options for you. Estrogen containing birth control will not be a good option for you. We can maybe use progesterone only. So it also depends on your medical history. Depends on your plans for childbearing. I want to have kids in the next 1 year. Probably not an IUD, right? Because that lasts 5 years. So it all depends on your situation, your health history, but knowing what each one is, how long each one lasts, what your responsibility is with each one can help you better make a decision. All right, if you'd like to learn more about other things about your body, check out my page and don't forget to subscribe to my YouTube channel. I'll see you next time.